Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter S. Today I'm going to talk about actually how to tell the severity of diseases. Of course, there's no disease is minor or is not important or it's really you think you can ignore it, particularly for those long-term or for those who had chronic other diseases. And so this all the diseases actually really need medical attention to discuss with your physician, even though the management is probably simply took over-the-counter medication or just follow up, but still it's comforting for you, and also your physician knows and will tell you the prognosis, and you will know how to follow up in terms of the management. So in general, on top of that, prioritize the emergency situation, the very severe diseases which are life-threatening situation. Those are, I think I mentioned before as a doubt, acute injury, and for those older people, altered mental status, or regardless of young or old, the temperature is high, about 1 or 2, and lasted and cannot be brought down by the medications. That's definitely emergency. And also for those who had previous medical histories like cardiac disease, hypertension, and any changes of the heart rate, and also lost the strength of limb, paralysis of individual limb or half or leg or arms, or chest pain, shortness of breath, difficult breathing, and change the color of the lips and change the color of the skin. So all of these are the signs you need to see the physician. The sooner the better. And also there's another special for middle age or young age. If you're overweight or obesity, if you have premature family history of premature heart disease or premature myocardial infarction or premature stroke, which means at a young age have those kind of family history. If you develop this kind of symptoms, it's also you need to see a physician. The sooner the better. And for the young children, for example the infant, you follow up with your physicians since the child is born. 2 weeks and a couple of days, 2 weeks, probably 1 month, every month after, and immunization. If the infant lost the strength of sucking milk, or changed the color of the skin into blue, or are really quiet, you feel limb like the extremity is very soft or flaccid, or the heart rate dropped below 100, all of these signs, or of course on top of that the fever, or the body is cold, either high or low temperature, those are for the newborns. Definitely these are all the signs you need to see your physician emergency as soon as possible. Or the jaundice, the change color, particularly for those some people the skin are darker, the jaundice cannot hard to tell whether it had jaundice or not jaundice. If the jaundice lasted beyond 2 weeks, so still you need to see your physician or emergency as soon as possible. So this is for the newborns. For the young children, I think the same idea. Of course, the injury is also emergency, or the temperature. One of the most common problem for the young children is infection caused the high temperature, cannot brought down by the medication, or the child looks very sick and no strength, not as active as before, or severe congestion. You think that it's just nasal congestion, but this severe congestion caused the hypoxia. The lips change to purple or blue. That's also the emergency. Or for the young children, aspiration, the foreign body aspiration. Suddenly, probably you were busy and the child playing with toys suddenly developed this lips blue or choking or something like this. The sooner the better, bring the emergency, unless you know the maneuver to do it. But sometimes I think the emergency probably is the best. And for the so these are the prioritized, the severity of disease. These are all the group of severe diseases. If not treated on time, if not seen physician in time fashion, the consequences might be very severe. Sometimes it could be life-threatening. So this, and also in general, these are for the acute condition. There's some acute conditions. If you think I just have the upper respiratory infection, I just had viral infection, nasal congestion, no fever, may or may not have fever, and a couple of days you think I can overcome it, I can get better. And some of them you can actually, but you just need to drink fluid, take vitamin C, and over-counter medication, sleep well, make sure, and you can. But some of patients, some of people, this kind of upper respiratory tract infection can go deeper to last the cough for probably a couple months until summer or even longer, and that's really becomes chronic problems. Usually those kind of the asthma. So if that's the case, if you had this upper respiratory tract infection a couple of weeks later, the cough still lasts, go see your physician. There might be something can be done to dilate your bronchi, or to give you some medication to accelerate your recover, instead of just going by itself becomes asthma. So these are the conditions move down from the life-threatening situation, or for young people or adult, middle-aged adult without any disease. Of course, injury is the first priority to see a physician to get it checked. Regardless, you think it's okay, it's not serious, but sometimes you do not know. Just get it checked, probably just to confirm and to comfort. And for the other important group of diseases, I think I mentioned, some of them could be minor, like just the pain, back pain, or the joint pain somewhere. You think it's nothing serious. Probably it's not serious, but still, if the pain management can improve your lifestyle, can improve your life quality, why don't go to see a physician with them to help you, professional helps, and to improve your life quality. And for older people, of course, particularly for those older people with comorbidities, follow up with your physician. Regardless whether you think I'm not in the acute phase or I'm almost recovered, if there's anything changed from your regular, either for example the heart rate or the blood pressure or anything, the new onset headaches or new onset blood pressure problem, anything, just beyond your normal regularity, something changed, talk to your physician and they will give you advice, help you to manage. And for those older people without any diseases, that's really is a blessing. I think I should congratulate you for lived old age without any diseases. But still, you need to, like the degenerative changes, it's unavoidable. It just happens to everyone. If you have vision change or joint feels stiff, or back pain, or sleep or depression, a sleep problem or depression, anything of those, just you talk to your physician, and I'm sure they will help you to make your older life, I mean the life of reverence with honors, to make you live probably better. So this is about the severity of disease. Basically, it's kind of put everything together for different age groups and what kind of a serious problem, what kind of problem that you think you can see your physician as a regular appointment, or what kind of condition you need to see the emergency. I hope it helps. It's kind of here or there because I did not think about it until sitting in front of camera, but I hope still give you some idea, help you as a little reminder for you to see your physician. So I'm going to stop here today, and thank you for watching. I will see you next time.